Navigating healthcare information can be difficult. With so many terms and definitions involved, it's not always easy to understand your plan's cost sharing. Knowing the difference between preventative care and diagnostic care will help you understand where you may have cost sharing. Here's the simplest way to understand these services. Preventative services prevent or detect health problems before you show symptoms. Diagnostic services diagnose or treat existing health problems. Preventative care can include screenings, lab tests, immunizations, and patient counseling. These services typically happen during an annual physical exam from your primary care provider. The list of services that are considered preventative and covered with no cost sharing is defined by nationally established guidelines. Diagnostic care includes services that assess your symptoms with the goal of treating an existing problem. These services typically happen when you aren't feeling well and visit your doctor to see what might be wrong, or get treatment for an existing condition. So, how does this help determine your cost sharing? Many preventative care services have zero out-of-pocket costs when you visit a doctor in our network. Diagnostic services, however, will most likely involve cost sharing. That means you'll pay part of the cost, and AllWays Health Partners will cover our part. Here are some types of cost sharing you might have for diagnostic services. Also known as a copay, a copayment is the cost you're required to pay for certain covered services and/or prescription medications. A deductible is the amount you may be required to pay in a plan year for certain covered healthcare services before your health plan starts to pay. After you've met your deductible, you may also be required to pay a copayment and/or coinsurance. Coinsurance is the percentage of the cost you're responsible to pay for certain covered services or prescription medications. For example, if your coinsurance for a service is 20%, your insurance will pay the other 80%. Let's look at some different scenarios to explain why the services involved are preventative or diagnostic. Say you get a cholesterol screening during an annual physical exam. The goal of this service is to detect a problem you haven't shown signs for, so it would be preventative. In this example, that same cholesterol screening would be diagnostic. That's because the goal of this test is to monitor a known condition. Finally, there might be times when preventative care becomes diagnostic. If you visit your doctor for an annual physical, that visit would be preventative. But if you tell your doctor about a symptom you've been experiencing, like a sore throat, and they do a strep test to diagnose the problem, the test would be diagnostic. If you need more information or want help understanding your plan details, here are some ways you can learn more. Your doctor's #1 job is to look out for your health. That means recommending tests and treatments to help you live well, even when those recommendations aren't necessarily covered at no cost to you. It's important to talk to your doctor about the procedures, tests, or screenings they recommend. You should always know why you're getting certain services. When you need information about covered healthcare services and costs, you can find it on AllWays Health Partners' secure member portal, allwaysmember.org. After you log in, you can view a list of covered preventative services by clicking on the My Coverage menu, then the Medical page. If your doctor or the member portal can't answer your questions, you can always call our customer service team. Everyone on the team is friendly, helpful, and has a deep understanding of our plans and benefits. They can give you information on how much of your out-of-pocket max and/or deductible you've met, and help figure out if a service is preventative or diagnostic.